নমস্কার, আপনারা দেখছেন হেডলাইন্স কলকাতা। আপনাদের সঙ্গে রয়েছি আমি দিশা। এই মুহূর্তে আমরা চলে এসেছি কলকাতা প্রেস ক্লাবে। কলকাতা প্রেস ক্লাবে আয়োজিত হচ্ছে অ্যাপেলোর ৪২ বছরের হেলথ অ্যান্ড হ্যাপিনেস প্রেস মিট। সেখানে আমরা চলে এসেছি। অ্যাপেলো এই ৪২ বছরে কী করেছে তারা শুনেছি তারা নতুন রোবোটিক সার্জারি চালু করেছে। তারা এখন ক্যান্সার পেশেন্টদের জন্য আরও উন্নত ব্যবস্থা চালু করছে। সেই সব কিছু জানতেই আমরা চলে এসেছি। আপনারা দেখতে থাকুন।
সবাইকে স্বাগত। আজকের প্রেস ক্লাব আমাদের ঐতিহ্যবাহী একটি প্রেস ভাই বোনদের বসার জায়গা, একটা যোগাযোগের জায়গা। শুরুতে অপোলো হসপিটাল চেন্নাইয়ের তরফ থেকে আপনাদেরকে স্বাগত জানাই আজকের এই প্রোগ্রামে। আজকের প্রোগ্রাম বেসিক্যালি অপোলো হসপিটাল চেন্নাই 42 ইয়ার্সে পদার্পণ করেছে। এই যে 42 ইয়ার্সের যে জার্নি, সেই জার্নি আমরা যেমন একজন পার্টনার অফ দি হসপিটালস, আপনারাও আমাদের পার্টনার্স। আপনারা যদি পার্টনার্স না হতেন তাহলে কিন্তু এই জায়গায় আমরাও পৌঁছতাম না। একটাই কারণ আপনারা সবসময় আমাদের ইউনিক জিনিসগুলোকে সবসময় তুলে ধরেছেন মানুষের কাছে একটা চিকিৎসার সুবিধার্থে। তো আজকের এই প্রোগ্রাম দেরি আর করবো না, সবাইকে একটু সামনে এগিয়ে আসতে বলছি। আজকে আমাদের সাথে উপস্থিত আছেন আমাদেরই গ্রুপ সিও ডক্টর ইলেন কুমার কলিয়ামূর্তি, গ্রুপ সিও অপোলো হসপিটাল চেন্নাই। উপস্থিত আছেন মিস্টার শ্রীধর রামান, ভাইস প্রেসিডেন্ট অপোলো হসপিটাল চেন্নাই। মিস্টার নাগার্জুন রেড্ডি, উনি আমাদের কাছে সবার কাছে প্রিয় এবং সবার সাথেই ভালোভাবে সম্পর্কযুক্ত সিনিয়র জিএম। তো একে একে করে সবাইকে আমি ডেকে নিচ্ছি। So I just call upon Dr. Ilen Kumar Kalyamurthy sir, Mr. Sridharaman sir, and Mr. Nagarjun Reddy. So I should not be wasting much more time. আমি ডেকে নিচ্ছি Dr. Ilen Kumar Kalyamurthy. He is our Chief Executive Officer, Apollo Hospital Chennai, Chennai Region Total Hospital. Chairperson in the CIA Tamil Nadu Healthcare Panel, President in the Liver Transplant Society of India, Senior Consultant Liver Anesthetist and Inventor.
First of all, I want to really thank for all of you for coming in here to meet us. I felt that this is really an emotional moment for us. If you take it Apollo Chennai, we have been serving patients of West Bengal for more than 40 years. We just wanted to thank the people from West Bengal for having huge trust on us. That's not easy. Traveling many thousand kilometers, staying in some other state, not knowing the local language, but still have been traveling for more than 40 years to get treated. It's not easy at all. Still, people have been doing it for more than 40 years. We just wanted to say a big thank you for the trust they are having on us. I also want to thank all the partners and doctors, many people from West Bengal who is assisting patients to get treated here and also in Chennai and help them to travel to Chennai. I want to have a big thanks to all the partners from various verticals, including government, including the medical circle, including the facilitators, Apollo information centers. I want to say big thanks for all of them. And I met a few of you outside. I think they have asked some very interesting question. How the same kind of treatment, what you are offering in Chennai can be available in Kolkata? When are you going to do that? That's actually a fantastic question. If you ask our chairman, Pratap Reddy, Dr. Pratap Reddy, the reason why he started Apollo Hospital is very interesting. He saw patients 45 years back dying in Chennai, unable to get treated. The only option for them to survive was to travel abroad to get treated. That's the only reason he started treatment on the Apollo group of hospitals 42 years ago. He doesn't want any Indians to travel abroad. I'm sure the same vision is applicable to people in Kolkata also. That's the reason Apollo also has built in a big hospitals in Kolkata. So why should people travel to Chennai get treated? One of the most important reason is, say if there are 100 kind of procedures or treatment or diseases available, I'm sure locally we can treat more than 90-95% of the problem. The other 5% of the problem needs huge expertise, infrastructure, equipment, training, process, protocol. There are so many things involved to offer the highest possible quality of service to another 5 to 10% of the diseases or illness or patients. So this is the reason why people have to still travel to Chennai to get treated. I can put some examples where Chennai Apollo hospitals are leading the world in terms of high-end medical treatment. One area is robotic surgery. People used to, I'm sure many of your relatives or friends, 10-15 years ago, if they had a heart attack, how do they do the heart attack surgeries? Doing a bypass. Today, bypass, they have to open the chest, they have to make 20 centimeters incision in the chest, and the scar will be there forever. Now, many of the patients can get the same bypass surgeries through a very, very small hole through robotic surgeries. That's how the technology has grown. Many of the patients won't even have we call it as a sternotomy. Chest opening is called as a sternotomy. That incision is not at all required. They will be having only few centimeters scar on the side of the chest. That's it. Again, same thing is applicable in abdominal surgeries also, tummy surgeries also. If somebody is having, say, liver cancer, colon cancer, or prostate cancer, previously they will be having 15-20 centimeter incision scar in their tummy. Now that is completely gone. Patients can come there, get this robotic surgery done. They will stay very short period of time in the hospital with a very minimal blood loss, with a very minimal pain, with a very, very minimal scar. Actually, all these technologies have completely transformed the way we treat patients nowadays, and Apollo hospitals have invested hugely not only in the equipment can be brought by anybody, but bringing that expertise, bringing the surgeons, bringing the nurses who can operate this equipment matters a lot. That's what we have done for many years. If you look at this CABG, we call it as bypass procedures, we have started long back, even before other hospitals knew that it can be done. We started 10 12 years back itself, and we are leading the country in terms of numbers in these kind of procedures. So robotic surgery is one area where Apollo Hospitals is still leading the country and many of the countries around the world. Second thing is cancer therapy and cancer procedures. If you take, we have the proton facility, which is the only facilities available in the country. If you take any transplantation, including bone marrow transplantation, we are leading the country. And any other cancer therapies, whatever you name it, it's all available in Chennai. So that can be number two, where we ourselves differentiate from the rest of the people in the country actually. So we are leading that area. And then bringing in newer technology, kind of artificial intelligence, whether it's genomic therapy, we always becoming the pioneers in terms of bringing in all these newer therapies. So we always offer these kind of services to people in West Bengal and around the country. And the fourth is transplantation. Transplant is a very, very complex subject. Whether you take heart transplant, lung transplant, bone marrow transplant, liver transplant, all these surgeries are very, very complex surgeries. Apollo Chennai is still leading the country. That's the reason we get more than 15,000 patients. People travel from Eastern India, Northeast and West Bengal. More than 18,000 people travel to Chennai to get treated. Of course, for the period of time, that number should come down. We want to develop the service locally, but until then, we are there to help the people of West Bengal. And I want to once again thank all of you for being here. Thanks for trusting Apollo Chennai.
Can you explain why robotic surgeries are better than traditional surgeries nowadays?
So, robotic surgeries assist the traditional surgeons to perform the procedure in a better way, because it has got a very miniature equipment within the robotic system, where the surgeons are able to access to the parts of the body where previously they can't approach conventionally. That's point number one. Second thing is, if you do procedures robotically, one good example is previously bypass surgeries for the heart, you have to open the chest completely. I'm sure you could have seen some of your relatives having a big scar in the chest who has got operated 10 years back from here to here. Big thick scar was there in the chest. Now through robotic surgeries, very minimal hole is made on the side of the chest, There's no need for the big hole in the front of the chest for bypass surgeries. If somebody wants to have a tummy procedure, say they have a cancer in the prostate or cancer in the liver, they used to have 10-15 centimeter big incision in the tummy to get approached. The robotics, there will be very minimal few centimeter scar will be there. So patients will not have much of pain, less blood loss, better clinical surgical outcome happens when you do the robotic procedure. Scar is also very less. So somebody getting operated through robotically, they can go back to work, they can be completely normal quickly compared to the conventional procedures before. That's an advantage of robotic surgeries.
Do you plan to bring any of this machine or technology in Kolkata in future?
That will definitely happen. I think that's one of the visions for our chairman, Dr. Pradap Reddy. 42 years ago, he started a hospital in Chennai to say that he doesn't want any patient to travel abroad, any Indians to travel abroad to get treated. Now we are bringing in so many patients to India from multiple countries. Now the number of patients coming from West Bengal to Chennai or any other state have significantly come down in the last 10-15 years. You would have also noticed that. I am sure in the next 5-10 years down, all this technology, including robotic surgeries, will be available locally so that the patient doesn't need to travel outside the state. I am sure that will happen very soon. And if you look at the medical fraternity here, they're all highly talented. I think this technology and this talent with the government support, things will completely, even it is growing very significantly, it will grow further. I'm pretty sure about that. See, Chennai as a region, it has multiple hospitals. There's a hospital for children, there's a hospital for women, there's a hospital for cancer, there is a hospital in Grimsworth which offers many of the services. So any patient, any age group, any disease, any complexity can be treated in Chennai. That's a differentiator. For example, proton therapy is not available anywhere in the country. It's available in Chennai. In children, if the child has got a very complex heart disease, we can do it in Chennai. Yeah. If there is a complex abdominal surgeries, say prostate cancer, which needs robotic therapy, we can do it in Chennai. If there is a genetic or preventive health, we offer the highest possible standard in Chennai. So Chennai has got its unique differentiator compared to any other hospitals.
Cancer patients, what new treatments are available now that were not accessible few years ago?
Proton therapy is a good example. Previously, we used to have radiation therapy, which has been offered. Proton therapy is a very high capex investment needed for proton therapy. We are able to bring it to Chennai. That itself is a good differentiator. Even there are a lot of newer therapy have come in, medical therapy also come in cancer, that is also being utilized. Immunotherapies and all these therapies are available. We are also giving it. Even robotic surgeries is also new to cancer surgeries. So there are 3-4 things happening in. And again, prediction with the genetic testing, we are able to predict which patient can get a cancer at later point in life. So all these things are new in the last 5-10 years.
What is the primary health concern you are currently observing patients from Kolkata or West Bengal?
See, lifestyle diseases are growing up, not only in Kolkata, across the country. For example, the patients are more diabetic, obesity is growing up, there are more incidents of cancer. I wouldn't say it's more incidents, patients are able to pick up the disease much higher than before. So these are all the changes we are able to see Kolkata in many parts of the country also. Thank you so much. Thank you.
Can you please tell me?
I am Dr. Ilan Kumaran. I am the CEO of Chennai Apollo Region Hospitals. Thank you.
আপনারা দেখতেই পাচ্ছিলেন এতক্ষণ আমরা ছিলাম অ্যাপেলোর 42 বছরের হেলথ অ্যান্ড হ্যাপিনেস প্রেস মিটে। এখান থেকে অ্যাপেলো সংস্থা আস্থা দিল যে এরপর থেকে পূর্ব ভারতের বা কলকাতার যে কোনো রোগের সমস্যার সমাধানই অ্যাপেলো করতে পারবে। আপনারাও সেটা দেখতে থাকুন, আপনারাও নজর রাখুন কীভাবে অ্যাপেলো সেই কাজটা করছে, আপনারাও যান, আপনারাও চিকিৎসা করান। আর দেখতে থাকুন হেডলাইন্স কলকাতা। ক্যামেরায় জয়গিরির সাথে দিশা দাসের রিপোর্ট, হেডলাইন্স কলকাতা।
আনন্দ আর ভালোবাসার দীপ্তিতে গড়া সমুজ্জ্বল পরমা, ঠিক তোমারই মতো। শ্যাম সুন্দর কোম্পানি জুয়েলার্স, আগরতলা, উদয়পুর, ধর্মনগর, কলকাতা।